All right, how's it going? I got another video for you. So let's just get into this. Frustrated Ohio legislator wants to curb Action's power in coronavirus pandemic, and this was put out a few days ago. I got another story where he kind of responds to it, I guess. This is a photo of John Becker. Like I said, this came out on May 2nd originally. It says that, yeah, we can see him right here. It says that Rep. John Becker said Governor Mike DeWine should take the advice of doctors such as Ohio Health Director Amy Acton as recommendations. He plans to introduce a bill making all public health orders advisory rather than mandatory. So it gets in this whole it gets into this whole idea too that like someone who's like not an elected official could suddenly like mandate orders even when the governor's not supposed to. It's supposed to go through like the legislative process to become an order. When state legislatures return to work next week, which should have been just I guess today or yesterday, they can expect at least one proposal to reduce the power of the state's top health official. State Rep. John Becker, a Republican from Claremont County's Union Township, plans to introduce a bill that would immediately make all public health orders advisory instead of mandatory unless the legislator approves them, which is the way it usually runs. The bill would apply to orders issued by State Health Department Director Dr. Amy Acton in recent weeks to address the coronavirus pandemic and to future orders. She can issue all the orders she wants all day long, but they are deemed advisory under the bill unless General Assembly declares them mandatory, Becker said Saturday in an interview with the Cincinnati Enquirer. Becker said he doesn't know yet how many fellow legislators support his Need Ohio Working Now bill, but fellow House Republicans loudly criticized Acton and Governor Mike DeWine last week. Because DeWine's supposed to be a Republican, or is technically a Republican governor, but the way he's acting is not like that, where he's like, this whole idea where like, he's like this governor that's kind of using like this overreaching power outside of his limits and doing stuff he's not supposed to be able to do within the Constitution. Becker told the Enquirer that he has been flooded with calls and emails from constituents frustrated that the state's economy has not fully reopened. Nearly 1.1 million Ohioans, 18% of the state's workers, have filed for unemployment benefits over the past 6 weeks. The health department's director has broad statutory power to make special or standing orders or rules for preventing the spread of contagious and infectious disease according to state law. Let's see what this actually is here. I guess it pulls up a state law here if you want to look at that. Acton and DeWine have issued more than 24 orders, including a limit on large gatherings, a halt to elective surgeries, the closing of polls, and a requirement that Ohioans stay home unless they are leaving for essential and work activities. The state's stay-at-home order has been extended to May 29th. It's supposed to open on May 1st. Everything's supposed to start opening back on May 1st. Then, like, in the middle of the night, like on April 30th, they went and passed it and extended it for another 4 weeks. There were restaurants that were, like, set up and planned to go the next day following social distancing guidelines. And basically the cops were there to stop them. And it wasn't the fact that they said that they were, like, going to just cite them or whatever. Like, they were, like, going to shut them down and take their license away so they couldn't continue making a livelihood. There's another story I want to go into as well. Like, I keep bringing up, there was a tattoo artist in North Carolina that essentially got jailed. There was a woman in, I believe it was northern Texas. Like, she was, like, opening up her salon. She was only bringing one person in at a time. Gloves, mask, everything. Then they were, like, citing her. And I think they brought her in front of a judge today. I kind of want to do this story either today or tomorrow. It's probably, there's a lot of people covering it. Like, there's, like, I think they said it's, like, a Democratic judge brought her and said, oh, if you apologize, you just have to pay the fine. She's like, no, I'm not apologizing. I need, like, me and all the people that work under me need to make money so we're, like, able to feed our kids. So I guess they like sentenced her to like 7 days in jail and like a $7,000 fine. And that's, so people are like trying to, like, you could say, yes, the coronavirus is something that needs to be taken seriously. But if you're following the social distancing guidelines, and if we go to the CDC, like the death rates, according to them right now, are around 45,000. But they're saying it's close to 100,000 if they include pneumonia, influenza, and COVID. But just the COVID deaths by themselves are like 44,000. Yes, it's something that needs to be taken serious, but it still is something that's on par with some of the seasonal flu numbers from past years. And the fact that they're neglecting people's ability to, it's not, obviously it's not all states and governors. I keep bringing up I think it's South Dakota's governor, Kristi Noem. Like, you can like highly suggest to do certain safety protocols, but you can't just like be tyrannical and shut down businesses and destroy people's lives. Then people kind of want to bring up like, oh, well, you just want people to die. I'm like, I can say the same thing about you. There's like certain statistics coming out because of the economic thing. There's going to be like all over the world. There's going to be, it's saying here for the U.S., if we look at the, I guess, so it's saying, I believe this is worldwide, right? So saying worldwide, there's like 265,000 deaths. There's like 3.8 million cases. And in the U.S. here, we have, oh, I'm in the way. Hold on a second. So if we have the total amount here is saying like, which this is bad. Don't get me wrong. This is bad. And we have that in the U.S. But there's certain like statistics coming out saying that because of the economic impact of this, you even hear it now. You hear it now about certain things going on. Like there's like going to be a meat shortage because the whole supply chain itself is being broken. The whole supply chain itself is being broken. So like there's these things that either can't be brought to market, which is leading to, farmers and stuff like either like not being able to produce certain things. Like there's like a bunch of raw milk that had to be dumped because they weren't able to take it to a processing plant to process it, because you have to pasteurize it to be able to bottle it, to ship it out, to sell it. So there's like these estimates like worldwide, like more than 100 million are like gonna die from like starvation and death. And you have, I keep saying it's like almost like every video now, but you have people like not being able to either pay the rent or mortgage, not being able to purchase food. Then you can say, oh, go to a food bank, which people are like lining up long. Food banks are running out of food. I mean, getting to a certain point, it's going to start turning, hopefully it doesn't, but it may start turning violent in some cases. But hopefully it doesn't. But she's saying that she needs to like start making money so she's able to feed her kids. And same thing for the people that work under her. So, where was I at on this? Acton and Dewine have issued more than 24 orders, including a limit on large gatherings, halt to elective surgeries, the closing of polls, requirement of Ohioans stay home unless they leave for essential work and activities. The stay-at-home order has been extended to May 29th, with exceptions to allow more businesses to reopen. Dewine expects that more businesses will reopen within the coming weeks as rules are revised to protect employees and customers. The goal of the order is to reduce spread of the coronavirus to avoid swamping Ohio's healthcare system. There's other things coming out too, I think. I know they did it in California. Like they started doing like more testing of people, and they're showing like a large percentage of the population already have or have had it, and like they were just like asymptomatic, or they had like mild symptoms, like they got sick for one day, like back in November or December, like that. That this has like been like it's more widespread than they originally thought, which lowers the infection numbers and the death rates. The goal of the order is to reduce spread of the coronavirus to avoid swamping Ohio's healthcare system. Becker said Ohio did that, and it's time to lift all restrictions. Because originally they were like, oh, we'll do it for like, up till Easter. Then they extended like another 2 weeks, and now they're doing it for another 4 weeks. So it's like, it's going to be like 8 to 10 weeks total that they're like shutting stuff down. And a ton of these businesses and stuff, like, they're not going to be able to reopen. It's going to be too catastrophic for them to be able to reopen. And you got to keep in mind, like, 54% of businesses in America are small businesses. So it's like companies like 500 and less. They're not these huge ones. Like, most of them are small businesses. Dewine and medical experts across the country have warned that quickly reverting to normal will resort in a surge of infections that Ohio and other places have avoided with mitigation efforts. One of the latest warnings came Friday from a team of University of Cincinnati scientists. There's also other places too, like Germany's reopening, and they seem to be fine. Sweden, I believe, never closed anything down. They kind of like left it as is. And they're like, they should be like reaching herd immunity within the next few weeks. And they're like, their death toll is not higher or necessarily lower. It's like in par with other people. Revised state modeling predicted that infections would peak in mid-April at about 2,000 new cases per day. The largest one-day increase in reported cases has been 1,317 on April 20th. The difference has been attributed to Ohioans' adherence to public health orders, social distancing, and other recommendations. I know for me, I have still been going to work. I think at most they kind of put some tape out somewhere, but it got rubbed off in a few days. I mean, there are some people wearing masks. If you want to wear a mask, you can. Although there's an issue too, like if you wear like the paper medical mask, like I was talking to one person who's in healthcare, and they said, yeah, you're only supposed to wear those for like 30 minutes, and then become, and they like start building up their own germs and everything. There's a whole thing about it being like breathing in your own CO2. There's a whole thing too, because at one point they were saying that the public shouldn't be doing this because like the healthcare professionals need it. Then DeWine at one point was saying it's going to be mandatory to go into the stores with them. Then now he said he went too far with that. But I guess there's still some stores that are making that mandatory and stuff. So to me, it feels like a dog and pony show. Like, it's not really going to do anything, but we're going to make it look like we do anything. Because I went to one place, I'm not going to say what it is, but they're like, they don't really care if it's like a mask or if you put like a turtleneck up or whatever. It's just something covering your face, like whether it's like medical grade or not. Becker said he agrees that infections and hospital admissions will result if the economy is fully open, but the orders are a major violation of civil liberties, and that's illegal. Becker said that he doesn't blame Acton. She's doing her job, but that DeWine should take doctors' advice and recommendations as just that. I don't question the governor's sincerity and integrity, he said. I want to question his judgment. He's simply wrong. If we go into this thing that came out, this came out today around this morning. It's saying Governor DeWine's office says he will veto legislation that would limit Dr. Acton's power, which I think is a terrible thing. We'll maybe watch this. Like I said, it's published today. Columbus, Ohio. Governor Mike DeWine's office says the governor will veto legislation that would limit the power of the Ohio Department of Health Director. In an effort to stem the authority of Dr. Amy Acton, the amendment proposed by Republican lawmakers would limit any stay-at-home order issued by the Ohio Department of Health to 14 days. So, is it by a Republican lawmaker? Or no, it's the Republican lawmakers. It passed the House Wednesday 58-37 and now goes back to the Senate for approval. Should the department want to extend the order, it would need to be approved by an existing bipartisan committee called the Joint Committee of Agency Rule Review, which consists of 5 representatives and 5 senators. I mean, if something's going to be passed that severely affects, the people of Ohio, I think it shouldn't be passed by a single individual. It needs to have some kind of like bipartisan agreement to some degree. The committee would then decide how long the order would be extended until, if at all. On March 23rd, a stay-at-home order. It's May 6th right now, so it's coming up on 2 months here in probably about, 2 weeks? A little less than that. On March 23rd, a stay-at-home order in the state went into effect in an attempt to stem the spread of the coronavirus COVID-19. Last week, Acton extended the stay-at-home order known as the Stay Safe Ohio. They always try to brand it to be something like, how could you oppose this? We're just telling you to stay safe. Like, how can you tell me to stay safe when I can't afford my mortgage or I can't afford food for my children? Like, I kind of want to reiterate again and again, the COVID deaths are, yes, bad, but you can't destroy millions of people's lives because of that. It's like people are like screaming for you to like stay home. Oh, you want to kill people and stuff. This is what I was going to say earlier. Yeah. Also, you're being selfish in your own way because you're telling people to stay home as long as there's people out there to produce things for you, to ship things to stores, to ship them to you, as long as they like provide you service and you products and stuff. Long as they're working, those peasants, it's fine, which pisses me off. Long as like we're serving you, you can stay huddled in your home scared. But if you're somebody that needs you to bring me something, then yeah, we need you there. But like everybody else, you want to kill people? It's a very it's a backwards way of thinking. Now known as a Stay Safe Ohio order until May 29th. Yeah, that's like 8-9 weeks, something like that. Although exceptions have been made for businesses allowed to reopen as the state begins the process of reopening the economy. Dewine blasted the move, saying his fellow Republicans should be focused on increasing coronavirus testing, dealing with a $775 million budget deficit, and reopening the economy. That is reopening the economy. Well, depending on the budget, if you want people back to work and off of unemployment, that would help too. Also, like trying to get people unemployment that applied, like a month ago was still an issue, not being able to pay things. But I guess there is actions and stuff in order where you can't be put in foreclosure and you can't be evicted for, I think it's like 90 days or 3 months or something like that. But you also got to remember too, that say your mortgage is like $2,000 a month. By the time that fourth month comes along, like all that's due in full. So instead of paying $2,000 each month, at that point you're due for like $8,000 at once at that point. So people got to keep that in mind too. And I guess there's like certain contract jobs and stuff that you're like not able to get unemployment on too. I mean, yeah, they should get more testing, but that's still like more people out and about. Creating more uncertainty regarding public health and employee safety is the last thing we need as we work to restore consumer confidence in Ohio's economy, the governor said in a statement. Dewine spokesman Dan Tenery said the government would veto that measure and one that reduced penalties for violating the stay-at-home order if they made it to his desk. Yeah, because like I don't know if any in Ohio has happened, but like I said, North Carolina and Texas, and maybe in other places, like they're arresting people for trying to make a living, to pay their bills, to be able to buy food for themselves. Republican backers said the measure was an appropriate legislative check on the power of Dewine, which I think it is, and his health director, Dr. Amy Acton, who issued Ohio's orders. Acton has won praise for aggressive decisions to combat the coronavirus spread, but those who think the state is moving too slow in reopening the economy have directed their anger towards her in recent weeks. A small group of protesters stood outside her house last weekend, leading Dewine to later condemn the demonstration, saying, "Come after me." Well, she has her name on the order, so they have to go after her. They have been protesting them at the State House, and they've been just getting ignored, so that's like the next logical step is to go to her house. I mean, they're not breaking into her house like some of the people did with what was it, Carlson Tucker? I mean, they're not doing that. They're just like protesting on the sidewalk or on the street. So I'm not saying you necessarily go to people's house, but I mean, if you're not getting the results you want, that seems like the next logical step. The partisan divide over Ohio's reopening and its record unemployment emerged into full view at the State House as House Republicans approved the limits on the health department along party lines. We are dealing with orders of the director of the Department of Health that had no due process whatsoever, said Rep. Bill Seitz, a Cincinnati Republican, that had no hearings, that had no public comments, that had no oversight, that had no review by anybody save those in the executive branch. I mean, government is set up to be checks and balances. I mean, if it's something that is important, it can get put into the legislative branch. And if it is important, it should get passed through, pretty fast. I mean, even if you look at the stimulus bill, I mean, it has some issues, especially with like the Democrats wanting to hold it up to throw in like, kind of these like social justice kind of like things in there. Like, oh yeah, we'll because they end up giving like people were getting like $1,200 for the stimulus thing one time, but also I think like the Kennedy Center got like $25 million. I think for I don't know if it's part of that or just the CARES Act. I think Harvard got, I want to say Harvard got around, what was it? I can't remember if it was like 9 million or something like that, even though they have like in kind of like their own trust fund, they have, I believe it's like 27 billion. So they have like all this money sitting there, but they kind of grabbed all this money that they can. Democrats said that the legislation undermined public health policy and the state's responsibility to protect people during a crisis. I would say allowing them to be able to buy food and pay their mortgage is also something that's a responsibility. House Minority Leader Emilio Skies also said Acton made an easy scapegoat as an unelected official. Well, like I said, she's the one that's put her name on the orders. She's the one that shouldn't be able to really make definitive orders. She's an unelected official, exactly. That's the whole issue with it. Because they're talking about with Dewine, the way he's handling this, the way that he kind of recalled Ohio's like primary polling the day of and shut down polling stations. There's like a I guess a petition going out to recall him as governor because he's an elected official, so he can be impeached or recalled or whatever it is. But someone that's like unelected, how are the citizens of Ohio supposed to have kind of like action against that? We should not attack a woman just because she's exerting the power the legislator gave to her. Well, the legislators are the ones making the laws. House Speaker Larry Householder, a Glen Ford Republican, said he rejected proposals to require the health director to seek legislative approval before issuing orders. Under the current plan, once a 14-day order was reviewed, I think the legislator would make the right decision. I'm not concerned about that, Householder said. The measure's support was unclear in the GOP-controlled Senate earlier in the day. Senate President Larry Abholf said Ohio had a very positive response compared to other states. We're like one of the worst, I believe, other than California, Minnesota, New York. All those are democratically ran. We have like the one Republican one that's doing terribly. The measure's support was unclear in the GOP-controlled Senate earlier in the day. Senate President Larry Olf said Ohio had a very positive response compared to other states and noted that DeWine was very careful not to interfere with people's constitutional rights. The pursuit of life, was it life, liberty, and happiness, is being able to buy food. You can have businesses open up with certain conditions, but completely shutting them down and not allowing them to do it is not the way for it to be done. So that's my little spiel and all that. It's kind of a was a little ranty at parts, but tell me what you think about the whole situation. I think there needs to be, because you can't just have a single unelected person be able to like dole out orders. I mean, there needs to be some kind of checks and balances. That's the whole premise. That's the whole, substrate of the American government, like legislative, executive, and judicial. They're able to like check each other. I'm also wondering too, if that what it say is like passed in the, it was passed in the House, I believe. Let's go back to this. It's saying that it was passed in the House and it's supposed to go to the Senate. So I wonder if it goes there and it gets passed, but it goes to him. If it gets vetoed, if it goes back and gets passed again, can he just continuously veto it? I'm not sure how specifically Ohio's government works in that regard. But I don't know. Do you think Acton was doing correctly? I think, yeah, there's definitely like an overstep in power with that. But let me know what you think in the comments below. If you like this, you can give me a like. If you really liked it, you can subscribe on YouTube. On Facebook, you can give me a like and a follow. If you do want to support me, I figure if you're watching this far at the end, you can do so. I have a subscribe star. So if you want to do that, I think you can do it for like a couple of bucks a month if you want to. I mean, if you're not able to, don't, obviously. But that's my little, I guess you can call it rant on that issue. All right. Peace.